Union nurses working for Providence are raising concern about staffing and safety as several contracts are up for negotiation this year.
Meanwhile, the chief executive for one of the hospitals is responding to those concerns and says the union's been reluctant to come to the bargaining table. Fox 12's Audrey WEIL breaks down the very latest. Audrey?
Yeah, we heard from several nurses tonight who brought up a range of workplace concerns, but the biggest theme seemed to be the need for keeping staff and having enough staff for the sake of the nurses and the patients. More than 500 Providence nurses and their supporters joined a virtual meeting to talk about their needs and concerns to have a safe workplace. Nurses outlined their main concern being staffing levels, with many of their colleagues leaving, having to work extra, and not having enough people to cover.
At our facility, it's become a normal occurrence for the charge nurse to ask the off-going nurses if they can stay over because of how short-staffed the department is. Asking nurses to work for 16 hours straight, sometimes with only enough time during their shift to eat a bite as they're running from patient to patient, typically not getting an actual real break.
The Oregon Nurses Association represents more than 4,000 nurses in 10 Providence locations in the state.
All of us are doing more with less constantly. That is a theme across the board. Home health is no different. The increased stress and emotional toll it's taken on all of us has been profound.
The nurses' contracts at several locations are up this year. The one at Providence St. Vincent recently expired and is being negotiated now. We spoke with the chief executive there, Jennifer Burrows.
I think it's unfortunate that ONA is spending time attacking Providence and its caregivers rather than directing their energy at us coming to a mutual agreement at contract negotiations at our table.
She says when it comes to staffing, state law allow for unit-based teams that develop staffing plans, including breaks.
We request and encourage people to sometimes work over. We're not mandating people to stay working. I think it's important to recognize that if people say, I need to leave, that people do go. Now, I appreciate that the nurses feel compassion towards their team and their patients, and so they're willing to stay and work additional time.
She says their hospital is offering a competitive raise, including a 9% wage increase in the first year. Nurses have raised concerns about their own health care benefits, too. She says the hospital offers 3 medical plans that are also comparable to other health systems. And Burrows says they offered 8 negotiating dates, and ONA accepted 2 of them, one on Thursday and another next month. And the union says that they've also offered bargaining dates to the hospital that the hospital has turned down, and that while managers still get paid to negotiate, the nurses are not. Reporting live from Southwest Portland, Audrey WEIL, Fox 12 Oregon.